In a first of its kind Medilogues with the media organized by the IMA Goa State and Goa Union of Journalists in Panjim, a number of renowned medical practitioners and media personnel had a dialogue wherein the doctors spoke on a variety of relevant topics such as safe use of medicines, misuse and misconceptions of medicine, cost of medicines, IVF treatments, etc.
Lot of us are ignorant about various aspects of medicines, and this is where we fall short of many things. We should know what care has to be taken while purchasing the medicines, how to store them, what is the correct method of taking them, at what time, how many times, or how many days, what are the precautions that we ought to take, what happens if we do not take them properly, what are the side effects, what are the drug interactions. So all these facets of medicines a patient ought to know. Most of us do not know this and we fall prey to a lot of bad things. Medicines are a double-edged sword. They are of benefit if used correctly, but we should realize if used wrongly, they can backfire. Irrational use can cause a lot of things: improper treatment, under effects, side effects, and so many other things. What is misuse of prescription drugs? When a person takes a legal medication for a purpose other than the reason it was prescribed, or when that person takes a drug not prescribed to him or her, then it is misuse of the drug. One important example of misuse are herbal supplements. Are they safe? Use of herbal supplements has a long history, maybe dating back to thousands of years. But the herbal supplements that we get today, there's a nice term given to them, nutraceuticals, which can be purchased over the counter. Over the counter means without a valid prescription given by the doctor. We can just go to the pharmacy and ask for herbal supplement. These are labeled as all natural. Many of these herbal supplements have a label as all natural, but they are not always natural. They may not be safe. While these products are intended to boost health and may make claims to that effect, clinical studies regarding these products are missing. These products are not reviewed by Food and Drug Administration and their use can be risky. So consumers need to understand that even though the label may say natural, these products are not always safe. Even though these supplements may be from herbal sources, we have to realize there can be some potent chemicals present in them which can harm us. These can also have drug interactions with each other and with some of the important medicines that we take. Look at these herbal supplements or day-to-day items. Cranberry juice, ginkgo biloba, which is a craze nowadays, ginseng, onion, garlic, there's green tea. All these are craze nowadays, but these can affect and interact with common day-to-day medicines.
But late pregnancies, pregnancy after infertility. Day before yesterday, we have delivered a 52-year-old lady who was menopausal for 7 years, who lost her son 15 years back, and she was in tears. She was conceived with husband's sperms, another person's egg, and she has got a beautiful baby girl yesterday at the age of 52. Now, at this age, though her previous delivery was normal delivery, I'm not going to try a normal delivery for her. Obviously, the normal labor and the fraud, her pelvis has become frozen at the age of 52. So this is one of the reasons. Complications such as hypertension, diabetes, obesity, and antepartum hemorrhage drive the doctors to take up cesarean section much faster. And the biggest fear is, what if a complication arises? I'll tell you the situation of a person who is practicing in Sangay. He's got the facility to do, he's in the health center, he has got the facility to do a cesarean section, he's got an anesthetist with him. It is not his intention to do a cesarean section for a primary who has come to him. But when she has come to him at 8 to 10 centimeters dilated and her fetal heart is not so great, and he suspects that this perineum is such that if he tries to put in a forceps and deliver her, she's going to tear the vagina and tear the rectum and come out. He now wants to do a cesarean section. If he is going to transfer the patient to Auspicio or to Panjim, it's not going to be possible. It is physiologically and physically logistically impossible. If he undertakes a cesarean section, we cannot say, oh, you did an unnecessary cesarean section. Maybe she would have delivered. So circumstantially, the doctor has to take his decision in favor of the circumstances which then exist. Nobody can sit in the boardroom of a political party in Delhi and say, cesarean section rates have gone up. You be there in the labor room. Tell me, now you don't do this cesarean section. And I will not do. I decide to take a chance that this patient may deliver normal. And I am giving the trial of labor. Patient's heartbeat is coming down at about 3 or 4 or 5 centimeters dilated. Another 2 hours she is likely to deliver normal. But with the fetal heart dropping, if I am going to wait and this baby later on has anoxia and that comes 50th in the class, I can be sued. Is this happening? Yes. In the US, right, left and center. They produce the labor chart. You did not do a cesarean section, you pay $1 million for this. And the court says, yes, who told you not to do a cesarean section? See, now this is the kind of situation which is coming up and therefore we need to do. But what is the good part about cesarean sections which is happening? The maternal morbidity and mortality which was so high, mothers were dying at the time of delivery because there was no cesarean section done, has come down by almost 60 to 70% in the last decade, which is a phenomenal number of mothers which are living. And same thing with perinatal morbidity. Do you know that in spite of the rising cesarean section rate, 2.3 million babies will die immediate post-labor all over the world today? That means what was happening earlier? 10 million babies were dying about 50 years back. And therefore we have brought it down by 8 million babies which are surviving because of the cesarean section rates. And therefore the rising cesarean section rates are justified. Yet, doctors are human beings, doctors are corrupt, doctors can be cheaters, and therefore not everything can be blamed only on the patient. The doctors are at fault too.